Hello, everyone. How are you? All right, guys, check your inbox. I sent you guys the lecture notes. Good, good, good. Hanging in there. No complaints. All right, can you guys hear me okay? All right. Let's rock, guys. So last week we talked about the NCSBN test plan, right? Let me just make sure this is recording. Okay, good. All right, so the NCSBN test plan, that is your guide. I use the NCSBN test plan and I use Saunders. It doesn't matter what you use as long as you are trying to like stay on track. So this week we're doing health promotion and maintenance. All right, I would recommend that you kind of just grade yourself after each, like if you go here and do safety infection, put a check or a red check or a negative to determine how well you know this area, because this is your NCLEX, believe it or not. This is the NCLEX. So if we focus more on this in nursing school, I think we would have a better turnout. Okay, I just spoke to another instructor last week about it, the importance of it. So just remember, like before you begin, this is your review. This is your $1,000 review. Okay, some people are charging thousands of dollars for NCLEX review, and everything that you need is here. All right, so safety and infection control. I'm going to send you guys a link for later on tonight. If you want to go through the NCSBN test plan with me, I am going to send a link so we can continue going through the NCSBN test plan, because I do respect it. You know, it's my guide. Okay. So just for today, let's look at what we're going to be going over today. All right. So provide care and education for the newborn, infant, and toddler client from birth through 2 years. Look at this word, provide care and education. All right, that's what we are expected to do as nurses. We have to provide education throughout the lifespan. So this one is providing care and education to a preschooler, school age, adolescent. So there's that provide care and education again. So provide care and education for the adult client. Provide care and education for the adult client ages 65 and older. Provide prenatal care. Provide care and education to an antepartum client or client in labor. Provide postpartum care and education. So there's your OB. So that's your OB. Assess and educate clients about health risk based on family, population, and community. And a big one is assess clients' readiness to learn. You have to know the preferences, the barriers. Plan to participate in community health education. Educate client about preventative care and health maintenance recommendations. Provide resources to minimize communication barriers. Target screening assessments. Educate client about prevention and treatment of high-risk health behaviors. And assess client's ability to manage home environment and plan accordingly. and are perform comprehensive assessments. So health maintenance and promotion is just that. Take about 5 minutes, guys, to go make your checks or your negatives. Just gauge yourself, be honest with yourself. How would you do in this area? All right, take a few minutes to look at health promotion and maintenance and tell me, you know, grade yourself. What would you give yourself? And you can type it in the chat. What would you give yourself in this area? If you were being tested on this today, how well would you do? Okay, so a 70. Now, that's okay. There's different ways to master this area, okay? So for me, I learned through questions. Like I need to know, you know, I'm somewhat of a control freak. Most of us are. And we have very little time to waste. So what I would do to kind of, before I even start this area, before, you know, I start reading, because you can get kind of overwhelmed with the reading. Let me show you guys what I would do. Hold on a second. Let me show you. All right, so I would go to my Saunders. Check it out. This is my Saunders. All right, I will go to my Evolve, and then I would open my book, my Saunders book. So if I'm doing health promotion and maintenance, I'm going to go to student resources, exam review, open that, open this. This is why you need to buy this product, because you don't need another book. You kind of need another bank, a question bank. So there's study. Let me make it a little bigger. You have study, client's needs, and look, health promotion and maintenance. So go through these questions first. Do all 467. Like it's a study session. Look at the question, read the rationale. That's a whole lecture. That's a question lecture. It's a legit lecture. Okay, go through those things and, you know, start there. It'll give you an idea of how you should focus and what you should focus on. You see, teaching methods. You have outreach program, that's the community. You have so many different questions here that you can use that will help you kind of study for this area. So go to your question bank first. If you're using UWorld, that's fine. Just make sure that you're finding health promotion and maintenance. Okay, that's one easy way to get through that to improve in that area. All right, let's get it. Let's go. Let's do the review now. All right, so health promotion and maintenance part 1. Okay, so this is the NCSBN test plan, and I have broken it down from the NCSBN test plan to make it a little easier to kind of like a better guide, you know, just a guide. But first, I wanted you guys to understand the reason why I do it the way that I do it is because I believe in repetition. It is what has gotten me this far. You know, it has repetition doing worksheets has gotten me a very long way. And I understand if you don't learn that way, some people need to go deeper. Some people need to know like at the cellular level. I never been that person. Okay, I'm gonna let me just get what I need to get. Let me like memorize this stuff and let me keep pushing. Okay, because you're gonna really apply it when you get on the floor anyway. Right now, I just need to get my license. Okay, so repetition is a key learning aid because it helps transition a skill from conscious to the subconscious. Through repetition, a skill is practiced and rehearsed over time and gradually becomes easier. The worksheets helped me tremendously in nursing school. This is how I got through nursing school. Okay, so this is the reason why I do my worksheets the way that I do it. So let's go. I'm going to, you guys got your notes? Everybody got the notes? I sent everyone the notes too. Yeah, okay, perfect. Look in your inbox. I sent you guys the notes. All right, so this is a little worksheet that I use. You can make note cards, but it's going to make you get down to the nitty gritty, just like the questions. All right, so health promotion and maintenance questions. This is the little worksheet that I did. The first thing you're gonna put here, and I gave it to you guys in Word because I know a lot of you wanted to type it in. Word kind of scrambles it. I like PDF, but if you want it in Word, I give it to you in Word. I can't type and write at the same time, so you guys just have to listen to me, okay? So I can't type and read at the same time, so you're gonna have to listen to me. All right, so the first thing is physical development. We're here. Physical development. All right. That is what you have to know for every age group, right? A doozy. Physical development for every age group. So what did I do? I broke it down for you. You have to know the physical development for every age group. The next step is cognitive development. This one is cognitive. You have to know cognitive development. Piaget, good old Piaget, stages of cognitive development. You got to know it. Psychosocial psychosocial development. This is here, psychosocial. For every age group, you have to know the psychosocial development. You see? Psychosocial for every age group. That's Erickson. As nurses, we need to know the psychosocial development. Moral development goes here. Moral development. Moral, that's Kohlberg's. You have to know every stage of Kohlberg's stages of moral development. You see, I got to know it. So that means I have to figure it out. I got to figure out what is the moral developmental stage for each age group. Activities. Activities. You have to know the age appropriate activities. This is age appropriate. Age appropriate activities for every age group. Age appropriate activity for every age group. All right, age. You have to know that for every single age group. Do your questions and evolve. Health promotion. Health promotion for every age group. I need to know it for every last age group, from infant, toddler, preschooler, school age, adolescent, young adult, middle adult, late adulthood, my older population, my elite old, and very, very important, my pregnant woman. What are some things I need to promote for my pregnant woman? The next area when it comes to health promotion and maintenance is immunizations. So those are my vaccinations. All right. So immunizations, don't overlook them. There's a lot of questions that they can ask you on the board. I was talking to one of my students, former students, and he was telling me how he got the immunizations. All right. They'll hit you with that. Then you have your health screenings for every age group. Every age group has a different health screening. So I kind of need to know my health screenings for every single age group. All right. Nutrition. Every age group, there's a different nutritional fact or nutritional education for every age group. What I tell the infants is different from what I would tell a toddler. Is different from what I would tell a preschooler. So I have to know nutrition. And for nurses, I would say these are our higher level questions here. Injury preventions. We have to be able to protect our clients from injury at every age group. So this, I want you guys, this is a heavy, heavy, heavy hitter. You have to know injury prevention for every single age group. So remember, we specialize in safety. That's our thing, right? That's our thing. So every group, injury prevention. What injury prevention for a preschooler? What should I make sure I educate this preschooler about? What should I educate my school age child about? What should I educate my adolescent about? Young adult, middle age, late adult, old, elite old, and do not forget injury prevention for my pregnant woman. Very important. So can you guys see how this can be a serious problem? Health promotion and maintenance is intense. There's a lot that you are expected to know. So what can you do? You can do questions. I would do a note card. I would have a note card. Let me just show you. I can do my note cards, put it in my pocket, my health promotion note cards. I'll do infant. I'll say label it infant, and then I'll label it physical development, and then I'll put it on my note cards. And then I will go infant, and then I will do cognitive development. That will be a note card. I will do infant, and I will do Erickson's stage of development. That will be a note card. I will do infant and Kohlberg's. That will be a note card. Appropriate activities, age appropriate activities, that will be a note card. Health promotion and maintenance, that would be a note card. Immunizations for that infant to 1-year-old, note card. Health screenings, that will be a note card. Nutrition, that will be a note card. And then injury prevention, I will put this in red. That would be a note card. So I have for this age group, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, the big 10 note cards. So for every age group, I have a note card. For toddler, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you can read it. You can read about it. Me personally, I have to do active learning exercises. So make your note cards. There's a note card. There's a set for infants. There's a set for toddler. There's going to be a set for preschool. There's a set for school age. There's a set for adolescents. There's a set for young adulthood, middle, late, old, elite old, and then your pregnant woman. All right, any questions on how to set up for this portion? If you can do questions, you can do note cards. Any questions on that? So when you do your note cards, guys, don't write down things that you already know. Write down things that you have no idea. So as you're reading, write down for a pregnant woman, what's a physical development trait that I absolutely didn't know? I'm going to write it down. I'm not going to write down the things that I know. I'm going to write things down that I had no idea. So as you're reading, you're not rewriting the book. You are writing things down that I did not know that. I did not know about Kohlberg's for my I didn't know that. I'm going to write that down. Don't write down things that you absolutely know. All right. So let's do some questions. Let's do our 200 facts. It's 200 facts. It's actually going to be 175. I owe you 25, but I'll make it up to you, okay? So vitals. Let's start with vitals. I want to talk about infants today. We're talking about infants. We're trying to get through this worksheet together. I want you to use these notes to make your note cards. I want you to listen to me over and over and over again. And I want you to fill out these empty spaces because this is going to help you with the infant to the adolescent. This is going to help you fill out some of those boxes. Okay. All right. This is just a different way to learn all of that information, all that health promotion and maintenance. All right. So the first thing we need to know when it comes to physical development is a temperature. We have to know our vitals. All right. Our vitals is what? Blood pressure, respiration, pulse, O2. Physical development means knowing our vital signs. That's number one, physical development. So for a 3 month, you want the temperature you can anticipate the temperature being 99.5. In Celsius, that's 37.5. In Celsius, that's 37.5. Now, you can do an axillary temperature is okay. And rectal, if they need an exact measurement is necessary. So for a 3-month-old, if I need an exact measurement, I can do a rectal. I can do an axillary. I don't see how you're going to do oral. So you see, 3 months is axillary and rectal if exact measurements are necessary. And it's 37.5 in Celsius, because they may give you Celsius, 99.5. For 6 months, or 1 year, 6 months to 1 year is 37.7. 6 months to 1 year. All right, 37.7. 3 years, look, it's trending down. Down now. 3 years is going down. The temperature is normalizing. Look at that. 3 years, 37.2. And you can do axillary, you can do a tympanic, and you can do an oral if the child cooperates. And then rectal only if you need exact measurements for rectal. All right, so 37.2, now it's going down. 5 years, 37.0. Look at that temperature. Put this in red. There you go. That's you. That's me and you. Welcome to the club. Okay, this is us. This is what they consider like this is an adult temperature. This is something that we expect when we're on the floor. 5 years old. And then 7 years old, again, 36.8. Now it's something that you and I could recognize. So you can do an oral and you can do an axillary. And you can do a tympanic. This is tympanic. All right, you can do a tympanic. You can do oral, axillary, and tympanic. Nine years, 36.7. 11 years, 36.7. And then 13 years, 36.6. So you have to know your temperatures. Notice how they're trending down and they normalize by the age of 5, because you don't need to call the doctor. You have to be aware of expected findings. So the board is going to kind of call you out to know if you know when to call the doctor. All right. So let's talk about pulse now. Pulse rate. So how can I promote health? What can I expect as far as physical development? This is physical development. All right. I know you guys, I would definitely write down my vitals. So for a newborn, from birth to 4 weeks, 110 to 160 beats per minute. Infant, again, 90 to 160. Toddler, 80 to 140. Preschool, 70 to 120. School age, 60 to 110. School age, I'm sorry, this is going to be adolescent. This is adolescent, guys. Adolescents. Our adolescent is 50 to 100. Look how it's trending down. So by the time they get to adolescence, they should be in a normal sinus rhythm. They should be a normal sinus rhythm. 60 to 100 is what we're trying to get. That's a normal sinus rhythm. So look at the school age, 110, preschooler, 120, toddler, 140, infant, 160, newborn, 160. So remember repetition. So I put a little chart here, do it over and over and over again. You have to learn it because you're thinking about the physical development. You got to know your vitals. So use this. Do it over and over and over again. Respirations is also physical development because it changes. So what do I expect as opposed to what do I, what is unexpected? What is a complication? So newborn, 30 to 60. Infant, 25 to 30. That's breaths per minute. Toddler, 25 to 30. Preschool, 20 to 25. School age, 20 to 25. And look at the adolescent, 16 to 20. So you see it's trending down. So I'm not going to call the doctor. If I get a respiration of 25, if I get a respiration of 30 for an infant, if I get a respiration of 30 for a toddler, I'm not calling the doctor because that's expected. Again, I learned through repetition. So know your respirations, do it over and over and over again. Now for the fun part, our blood pressure, especially when you have a patient. You have patients, guys, that take heart medications. So how do you know if this patient if it's working? How do you know if that beta blocker is working? How do you know if that DIG is working if you don't know the vitals? So I had a student, this is an NCLEX question. She got digoxin and they needed to know about the toddler's vitals. What is a normal toddler vital? So they love to put this with digoxin. So I want to tell you guys, just go ahead and write DIG. Because kids get digoxin, kids get beta blockers, kids get furosemide. All right. Blood pressure. So for your newborn, the blood pressure is 64 over 41. Don't worry about hypertension yet. So 64 to 41. That's a newborn, full-term birth to 4 weeks, 64 to 41. And then for your infant, 1 month to 12 months, it's 85 to 50. 85 over 50. Don't worry about your hypertension just yet. Now we're at our toddler. So toddler, 85. As low as 85, as high as 91. This is your systolic. So your systolic can be 85 to 91. That's fine. And your diastolic for this baby. Sure. To which one? Go back to back to respirations. You don't have the you're gonna get the video. You're gonna get the video. All right, I'll upload it on YouTube. You'll get the video. I'll upload it on YouTube. Just kind of write your notes. Don't worry, you know, just write your notes. It's gonna be on YouTube. Okay. Mm-hmm. All right, so you got your blood pressure. Your blood pressure is 64/41, and then 85/50 for your infant. And then for your toddler, guys, your toddler, it can be 80, the systolic, which is the top pressure, the systolic can be 85 to 91. And then you have your 37 to 46 for your toddler. So you got to remember that, especially when it comes to furosemide, beta blockers, okay? Digoxin, you got to know your blood pressure. You got to know your vitals. Digoxin is more so heart rate. Beta blockers are given to toddlers. Some toddlers have cardiovascular issues. So remember that. Toddler, 1 year. This is the male. Let's do the female. Female, 86 to 89. '86 to 89. And then the diastolic is 40 to 49. So it can be 86, write it out, 86 to 49, to 89. And then 40 to 49. Preschooler, the male, preschooler, the male, 91. Look, 91 is increasing. 91 to 98. And then 46 to 53 is diastolic. So write it out. 91 to 98. And then 46 to 53. This is for our male preschooler. And then for our female preschooler, for your female preschooler, you have 86 to 90, no, 89 to 93. 89 to 93. And then you have 49 to 52 is a diastolic. So write it out. What's the range for this preschooler? 89 to 93. And then the diastolic, 49 to 52. That's for my preschooler. That's the female. Now, school age female. '96 to 106. And then you have your diastolic, which is 55 to 62. Write it out. 96 to 106. And then you have your diastolic, which is 55 to 62. School age male, 94 to 105. And then you have your diastolic 56 to 62. 94 to 105. Your diastolic 49. No, 56 to 62. Let's look at your adolescent. All right, adolescent. You have male and female here, because this is pretty much, if you get a question, it's normally gonna be a toddler or someone, but especially when it comes to like your beta blocker or your furosemide, because you know you can't give it if the blood pressure is too low. But I just combined the adolescent for you, so to kind of just make it a little easier when it comes to adolescents, because you're going to get questions on adolescents' blood pressure. All right, so look at the adolescent's blood pressure. Adolescent blood pressure should be less than the diastolic. The systolic should be less than 120. It shouldn't be above 120. And then less than 80 is the diastolic. So less than 120, the top number, and then less than 80, the bottom number. Yeah. So this is like, now we're into, now we can recognize this, because this is one that's been easier. But when it comes to like our kids, like our pediatric patients, you can see that it starts to basically, is opposite of respiratory and heart rate. It starts to increase. The blood pressure starts to increase. They're getting bigger, they're getting taller, they're gaining weight. So it takes a lot. That heart is beating now. The heart is, the blood pressure is increasing. And then when it gets to adolescent, that's when you and I were like, okay, I can recognize that. So let me just go back up. When it comes to physical development, guys, physical development, take a look at the worksheet here. Physical development goes here. I would definitely know my vitals. What do I put here? That's the biggest question. Everybody wants to answer the key. You have to write down things that you don't know. No one can tell you, I don't know what you don't know. So write down, when you're doing these worksheets, write down the things that you don't know. And we have a lot of issues when it comes to vitals. It's hard for me to remember pediatric vitals, toddler vitals, preschooler vitals. I would definitely write my vital signs down for each age group. And I would look at it. I would put it in my pocket and I would look at it. That is one thing that I will put under physical development, are my vitals. Okay, because it changes from infant, as the infant is growing, toddler, it changes. And this is, you give meds, you're gonna give medications to toddlers, school age children on the board. So how can you give a medication if you don't really know the vitals? And they're just gonna keep slamming you and slamming you and slamming you and slamming you with these health promotion questions if you don't know the vitals. So for physical development, I would write my vitals. All right. So that's vitals. Any questions on the vital signs? It's just repetition. It's repetition. And for those that are lucky enough to work with the population, it's just repetition. All right. So you can kind of, I didn't make a copy of this, but you can kind of make a copy and Write it over and over and over again. That's how I learn. Say what you want to say about me. That's how I learn. And I'm a good nurse. So let's talk about general appearance now. General appearance. So let's talk about our infants. We're going to talk about our infants now. Just the infants for now. Infants until the age of infants to 1 year. There, I am going to talk about some toddlers. I am going to talk about some preschoolers, but this is mainly like infants. There are little tips on the other age groups, but this is mostly, we're starting from the top. We're starting from the appearance of an infant. All right, until maybe we'll talk about a little toddlers, maybe a little preschoolers, but mainly we're going to talk about infants now. We're going to talk about physical development of that infant. And you decide what you want to make a note card. What are some things that you absolutely did not know? All right, so the general appearance of an infant. General appearance, muscle tone is erect. Head posture is expected in infants after 4 months of age. So after 4 months of age, muscle tone should be evident. So they should have an erect head posture. After 4 months of age, 1, 2, 3, 4, they should be able to hold up their head, erect. Makes eye contact when addressed. Okay, so when they're addressed, they should make eye contact. Now, not an infant, but between infancy and 1 year of life, they should be making eye contact when you call their name. And follow simple command. As they get older, from infancy to that 1 year, they should be able to follow command. Some people say like ta-ta, that means give, you know, they'll say ta-ta, that means give me what you have in your hand. So they should, between infancy and 1 year, following commands, guys. Now, why are we worried about this? Like, why are we worried about the general appearance? Because if you have a toddler that is not, if you have a toddler that is not, if you have if you have an infant to 1 year old that is not, you have an infant to 1 year old that is not, you have an infant to 1 year old that is not, I need to tell someone. I need to notify the doctor, the pediatrician. So this is expected, and we specialize in complications. So I need to know these developmental stages, these physical developments, because how do I know, how do I alert the doctor for a complication? So my general appearance, remember, erect posture is expected in infants after 4 months of age. They make eye contact when addressed and follow simple commands. Let's talk about skin. All right, skin turgor exhibits brisk elasticity with adequate hydration. How do I know that the baby is not hydrated? The skin turgor, they'll have tinting. It won't be brisk. It will remain. If I pinch it, it's going to remain pinched. It's called tinting. That's how we can determine adequate hydration. And 26, lesions should not be on the baby. Lesions are not expected. Lesions. And I want you to put this in red. They're hinting at a complication. I wouldn't even say it's a complication these days, but skin folds should be symmetric. The skin folds, underline that, that's an NCLEX. Skin folds should be symmetric. If the skin folds are not symmetric, that's a complication. All right, hair and scalp. Let's talk about the hair and scalp. Hair should be evenly distributed. Oh. Yeah, 25 is brisk elasticity. 26 is lesions are not expected, and skin folds should be symmetric. So skin turgor should be brisk. Hair and scalp. Hair and scalp. Hair should be evenly distributed. It should be evenly distributed. It should be smooth. And guess what? It should be strong. Manifestations of nutritional deficiencies include hair that is stringy, dull, brittle, and dry. Manifestations of nutritional deficiencies include hair that is stringy, dull, brittle, and dry. It shouldn't be stringy. It shouldn't be brittle. Hair loss or balding on infants can indicate the child is spending too much time in the same position. The same position. That's what even with your elderly population, you always want to look at the back of the head because that's an indication that balding spot, the child is spending too much time in the same position, in that supine position. So 30 is same position. 31, scalp should be clean and absent from any scaliness and infestations. So infestations, that's like lice, infestations and trauma. So the scalp shouldn't have any scaliness. It shouldn't have any infestation. That's lice, guys. And trauma. Assess children approaching adolescence for the presence of, now we're talking about the adolescent child now. For adolescent child, assess children approaching adolescence for the presence of secondary hair growth. So an adolescent is completely expected to have secondary hair growth. Hair under the arms, hair in the pubic area is expected. Let's talk about the nails. The nails, pink over the nail beds and white at the tips. If there's anything other than that, guys, it's an indication of a problem. So it should be pink over the nail beds and white at the tips. Anything other than that is a complication occurring. And smooth and firm, but slightly flexible in infants. So of course the nail beds are gonna be flexible. They're soft. They're flexible in infants. The nails are flexible in infants. It's expected. It doesn't mean a nutritional deficiency. It's expected. Let's talk about our famous lymph nodes. All right. Lymph nodes should be non-palpable. They should be non-palpable. All right. If you can feel them, like just by putting your finger there and you feel a lymph node, that's an indication of infection. All right. So lymph nodes that are small, palpable, and non-tender and mobile can be an expected finding in children. They're like a little pea. So again, lymph nodes that are small, palpable, non-tender, and mobile can be an expected finding in children. Don't call the doctor. All right, let's talk about the head. Now this, I want you guys to put in, I want you to write NCLEX. When it comes to the head, I want you to write NCLEX. This is huge, especially when it comes to these fontanelles. So the head, the shape of the head should be symmetric. That means it should be the same size, symmetric. Fontanelles should be flat. They should not be bulging. You see, flat. That's what it is. Fontanelles should be flat. Don't let them sway you any other way. Fontanelles should be flat. Now, the posterior fontanelle usually closes by 8 weeks of age. And the anterior fontanelle usually closes between 12 to 18 months. So for this guy, I put PF. So you see, posterior fontanelle, or it can be posterior first. I always put on my paper PF. It can be posterior fontanelle, or I can put posterior first. Posterior first, PF. If you know one, you know the other. PF, posterior first. That's a little tip. Okay, face. Let's talk about the face. Number 40. You're welcome. 40 is, oh wait. Face. Symmetric appearance and movement and proportional features, because symmetric appearance and movement and proportional features, because we're concerned with, let's just get down to it. We are concerned with fetal alcohol syndrome. We're assessing that patient as nurses. We're negative, all right? We are concerned with fetal alcohol syndrome. So we expect for the face to be symmetrical, symmetric appearance, and proportional features. For the neck, it's short in infants. They don't have a neck. Short in infants, non-palpable masses. It shouldn't have any masses in the neck. That can be a sign of non-Hodgkin's lymphoma. It can be a sign of lymphoma if they have masses in the neck. So 43, no palpable masses, because we're concerned with that cancer. We're concerned with that non-Hodgkin's lymphoma, and you can put that, I'm negative, whatever. We're worried about non-Hodgkin's lymphoma. So 43, no palpable masses. The trachea should be midline trachea, midline trachea. And 45 is full range of motion. All right, full range of motion is present, whether assessed actively or passively, meaning that the baby is flailing the limbs or you're doing the range of motion. So full range of motion. So it's an infant, should have full range of motion. For a toddler, full range of motion. For school age, full range of motion. For an adult, full range of motion. The midline, the trachea should be midline, and there should not be any palpable masses. I don't care how old you are. All right, let's talk about the eyes. All right. Eyebrows should be symmetric and evenly distributed from the inner to the outer canthus. So I want you guys to make sure that you look at a picture of the canthus, because guess what? We give eye medications. So this is for your eye mids. You have to know where the canthus is. So I was going to put a picture, but I didn't have time. Make sure you know what it looks like because we give eye mids. So eyebrows should be symmetric and evenly distributed from the inner to the outer canthus. Eyelids should be completely opened to allow the lower border and the most of the upper portion of the iris to be seen. So the eyelid should be completely open. Just underline open. And eyelashes should curve outward and evenly distributed with no inflammation around the hair follicle. So eyelashes, you're looking for inflammation. That is from infancy to old. Inflammation around the hair follicles, the eyelashes. So now I want you to just think about your eyelashes. Eyelashes should curve outward evenly. Think about your eyelashes, okay? Now think about your eyelids. Do your eyelids close completely? Go ahead and close your eyes. All right, now if you open your eyes, can you see your iris? Can someone else see your iris in your house? And now I want you to feel your eyebrows. Your eyebrows should be symmetrical and evenly distributed. Start from the inner canthus and go to the outer canthus. So just like that, guys. Just what we see when we look in the mirror, that's what we want to see when we do our assessment from infant to adult. Anything outside of that, we have to notify the physician. We're basically looking for any inflammation, and we're also trying to assess that infant for fetal alcohol syndrome. Okay. All right. Conjunctiva, I want you guys to make sure that you look at a picture of conjunctiva. So the peripheral fissures and conjunctiva should be pink. The conjunctiva should be pink. So I want you to kind of just pretend that you're putting contacts in, like hold your eye down. So the conjunctiva should be pink. It should be pink, guys. And the bulbar conjunctiva are transparent. And the lacrimal apparatus is without excessive tearing. So that's the tear duct. It should be without excessive tearing. And the sclera should be white, not yellow. It should be white. And the corneas should be clear. Because if the cornea is clouded, especially in our older population, that's an indication of, what is it called when you have the little white film over your eye? What is that called? If your cornea isn't clear and it's cloudy, you have the cataracts, right? So if it's like cloudy, that's an indication of cataracts. How many of you guys have seen it? Like how many of you guys have seen the corneas with the cataracts? All right. Pupils. All right, let's talk about the pupils. Pupils should be round, equal in size. They should be reactive to light, accommodating, and irises should be round with the permanent color manifesting around 6 to 12 months. So that permanent color, 6 to 12 months. So I want you guys to write down Perla, pupils equal, round, reactive to light, and they accommodate. That's our Perla. Pupils are equal, round, reactive to light, and they accommodate. See? Pupils equal, round, reactive to light, and they accommodate. And the irises should be round with the permanent color manifesting around 6 to 12 months of age. Visual acuity can be difficult to assess in children younger than 3 years old because it's just hard for them to follow the commands. So visual acuity can be difficult to assess. Visual acuity in infants can be assessed by holding an object in front of the eyes and checking to see whether the infant is able to fix on the object and follow it. So can the infant fix on the object and follow it? You can also use the tumbling E or HOTV test to check visual acuity of children who are unable to read letters and numbers. So that's that tumbling E or HTV test. Tumbling E or HOTV. So if they can't read the letters or numbers, they'll do that tumbling E. And older children should be tested using a Snelling chart. That's the letters. This is what you and I use when we go to get our physical exam, the Snelling chart. Okay. Now, peripheral fields, very important for health maintenance. So upward will be 50%. Downward is 70%. Nasally, 60%. And temporally, 90%. Those are your visual fields. Cranial nerve 3, cranial nerve 4, cranial nerve 6. Cranial nerve 3, cranial nerve 4, cranial nerve 6. That's your cranial nerves. Cranial nerve 3. So that's how you assess your peripheral fields. You do the cranial nerve 3, 4, and 6. 3, 4, 6, 3, 4, 6. Cranial nerves, peripheral fields. Extraocular movements. Extraocular movements might not be symmetric in newborns, right? Their eyes just roll all over the place. That's expected. But the corneal light reflex should be symmetric. They should have a corneal light reflex, that red eye. Cover and uncovered tests should demonstrate equal movement of the eye. And the 6 cardinal fields of gaze should demonstrate no nystagmus. All right. So remember your 6 fields of gaze, 3, 4, 6. So if you have your pen light, it should, the muscles should go to the pen light. It should go 3, 4, 6. It shouldn't be 3, and then you try to do 4, and the eye goes this way. The muscles are not intact. The cranial nerves are not intact. So you're looking for nystagmus, especially in your infants. because they're new and you're trying to test their ocular movement, extraocular movement. So nystagmus is a big thing. All right, color vision. Color vision should be assessed using the Ishara color test. I know if you guys have been hired before, you have to do the color test, the Ishara color test. The child should be able to correctly identify shapes, symbols, and numbers. The child should be able to correctly identify. Internal exam, red reflex should be present in infants. So red reflex should be present in infants. Arteries, veins, optic disc, and macula can be visualized in older children and adolescents. So the arteries, the veins, the optic disc, and macula can be visualized in older children and adults and adolescents. For the ears, alignment, the top of the auricules should meet an imaginary horizontal line that extends from the outer canthus to the eye. So the alignment, let me just spell it for you. The top of the auricules should meet in an imaginary horizontal line that extends from the outer canthus of the eye. Again, they're looking for fetal alcohol syndrome. So the top of the ear. So if I draw an ear, and then this is an ear, right? It should meet. They should meet. From ear to ear should meet. You see this top? That little flap? All right, it should meet in an imaginary line that extends from the outer canthus of the eye. The ears should meet. They should be leveled. All right, external ear. The external ear should be free of lesions and non-tender. They should be free of lesions and non-tender. No lesions should be on the ear, especially for our elderly population. The ear canal should be free of foreign bodies or discharge. And cerumen is expected. So cerumen is an expected finding, not compact cerumen, but cerumen is expected. Earwax is expected. For the internal ear, I want you guys to highlight this, especially when it comes to the tympanic membrane. So here is the heavy hitter that you see everywhere. In infants and toddlers, pull the pinna down and back to visualize the tympanic membrane. So it's down and back. That's the heavy hitter right there. That's your NCLEX question right there. Down in infants and toddlers, pull the pinna down and back. Now, what is the age of a toddler? What age group is considered a toddler? So a toddler is 1 to 3 years old. So 1 to 3, you pull the pinna down and back. 1 to 3 years of age. All right. So in children older than 3 years of age, pull the pinna up and back, up and back. So it's down and back and then up and back. So the D before the U, down and back, up and back. The ear canal should be pink. It should be pink. The ear canal should be pink with fine hairs. And the tympanic membrane should be pearly. Underline that, pearly pink or gray. Pearly pink or gray. the tympanic membrane. And the light reflex should be visible. The light reflex should be visible. Hearing. Newborn should have intact acoustic blink reflex to sudden sound, meaning if I clap my hands, they should have some type of acoustic blink reflex. They should react. So newborn should have intact acoustic blink reflexes to sudden sounds. Infants should turn toward, they should turn toward the sound. Older children can be screened by whispering a word from behind to see whether they can identify the word. It's called the whisper test. So older children and adults can be screened by whispering a word from behind to see whether they can identify the word. The nose. The position should be midline. Patency should be present for each nostril without excessive flaring. So patency. Flaring is a bad sign. Flaring is a complication. Smell can be assessed in older children, and older children smell. An infant is not going to be able to tell you they smell, but it can be assessed in older children. For your internal structure, the septum is midline. It has to be intact. The mucosa is deep pink in light-skinned clients and various shades of brown or gray in dark-skinned individuals. So the internal structures for a dark-skinned individual can be various shades of brown or gray. And the mucosa should be moist without evidence of discharge. The lips, darker pigmented than the facial skin. The lip should be darker, than the facial skin. Smooth, soft, moist, and symmetrical. Again, we're concerned about fetal alcohol syndrome. So smooth, soft, moist, and symmetrical. The gums, coral pink in light-skinned clients and various shades of brown or gray in our dark-skinned clients. And the gums, guys, which can get infected, you want them to be tight against the teeth. So why is this important? Because we give our patients medication for seizures, anti-seizures. All right. In particular, we give our patient Dilantin. So the gums can be an overgrowth. So you have to remember that they should be tight against the teeth. So a lot of medications cause overgrowth of the gums. So you have to know what the normal looks like in order to know if something is abnormal. So if they give you a picture of someone's gums and they have overgrowth, you know that gums should be tight against the teeth. It's not a cultural thing. It's not. It's abnormal. If the gums are not tight against the teeth, there's a complication occurring. Mucous membranes without lesions, moist, smooth, and glistening. All right, so it's gonna be, the mucous membranes, of course, will be pink in light-skinned clients and various shades of brown and gray in darker clients. So just because you have a mucous membrane that is gray does not mean that the patient is oxygen deprived. If the patient is a darker skin, then you can expect brown or gray in dark skin clients. You got to figure out how to assess that patient for low oxygenation another way. It's not brown and gray is not always a bad thing. Now, this is huge. This is an NCLEX question. I want you to write it down. NCLEX, the tongue, okay? Infants can have white coatings on their tongue from milk that can be easily removed. Oral thrush coating is not easily removed. If that child has thrush, and let me spell it out, that's not easily removed. So that's a complication. So I want you guys to put that in red. That's a complication. For adults, for our patients who have chemotherapy, for our patients who are taking medications, it is never, if you can tell the difference. If it can come off, then it's just normal. It's a white coating that can be easily removed, remove it. But a fungus is not easily removed. Children and adolescents have pink, symmetric tongues that are able to move beyond their lips. So especially when you have that infant, when it comes to feeding. All right, so they have pink, symmetrical tongues. Teeth, this is huge. Teeth is a big thing. Infants should have 6 to 8 teeth by 1 year of age. Children and adolescents should have teeth that are white and smooth and begin replacing the 20 deciduous teeth with 32 permanent teeth. So you have 20 baby teeth that will eventually be replaced by your permanent 32 teeth, and you only get 32, so you have to take care of them. So you have to teach the family how to take care of the teeth. So infants should have 6 to 8 teeth by the age of 1. Okay, for feeding, this is the issue here when it comes to cleft lip. This is comes to cleft lip. What is it? Cleft palate. So the hard and soft palate should be intact, firm, and it should be concave. Concave. All right, it should be intact, it should be firm, and it should be concave. So if it's not concave, how are they going to be able to breastfeed if it's not concave? If it's not firm and flat, how can I feed them? Think about Maslow's hierarchy of needs. That's why this is a huge problem. How is this child going to eat if there's an issue with the palate? And the uvula intact and moves with vocalization. So when the child cries, you should be able to see that uvula move. Tonsils. Infants should have, infants might not be able to, you may not be able to see the tonsils. 108, I want you guys to put an X next to it. That's NCLEX. Children barely visible to prominent, same color as surrounding mucosa. You see this for children? Barely visible to prominent. Guys, if there's an odor, if they are inflamed, it should be pink. It shouldn't be like red, like inflammation, because when it comes to our kids, tonsillitis is real. So it's a big problem in the community. So it's going to be a big problem on the NCLEX. So again, 108, children barely visible to prominent, same color as surrounding mucosa. 109, infants, they should have a strong cry. Children and adolescents, they should be clear and articulate. So that can be an issue also, guys, clear and articulate. I know that's kind of harsh to say, but it may be an indication of something is wrong, like developmentally. So we want to make sure that we're assessing. All right, guys, take a little 10-minute break and then we'll come back and do thorax and the lungs. We'll finish out. All right, guys, let's go. Let's rock. All right, we're on 111 now. 111. All right, guys, 111. Let's rock. All right, so remember your vital signs. Remember, we're doing health promotion and maintenance. One of the biggest things, if you look at the bullets, it tells you health promotion and maintenance is the health assessment. Despite what we learn in nursing school, you have to know your health assessment. So here we go. 111. Thorax and lungs. This is a heavy hitter. Remember, we specialize in airway, breathing, and circulation, right? So now this is like this is an NCLEX, especially just put NCLEX here. Here's another NCLEX question. All right, because the students, they tell me what's on the NCLEX. You know, I just try to give you guys as much as I can. So infant shape is almost circular with anterior, posterior diameter equaling, this is equaling the transverse or lateral diameter. This means that the baby is shaped like a circle. You see? Okay, so this is the chest. When you do a chest x-ray, right? You'll notice that they'll do an anterior and then they'll do a lateral. So for us, our anterior is 2. If I had to measure it, I'll do 2 to 1, right? When you have an infant, it is just round and round. There's no difference between the anterior and the lateral position. You guys have had babies, they have the big head, they don't have a neck, and the chest is like, it's like a barrel. It's the same size. It hasn't, the diameter hasn't changed. So let's go back over it. Let's read it again so you don't get confused. Okay. Now this is the NCLEX question because it is confusing. Infant shape is almost circular with anterior posterior diameter equaling the transverse or lateral diameter. It just means that it's the same. If I do an x-ray from the front and I do an x-ray from the side, it's going to be the same size. Now for an adult, look at 112. Children and adolescents, the transverse diameter to anterior posterior diameter changes 2 to 1. 2 to 1. So when I do an x-ray of the front, it's a 2. Let me just show you. This is the x-ray of the front. All right, this is my x-ray of the front. And then if I tell the person, okay, now turn to your left, it's going to be 2 to 1. With the baby is round. Okay, the baby is round, the infant is round. There's no 2 to 1 diameter. Look at a picture. Make sure that you really understand that. Okay, ribs and sternum are more soft and flexible. So the ribs and sternum are going to be more soft and flexible in infants. They're symmetric and they're smooth, and there should be no protrusions and there should be no bulges. The lungs should be very smooth, right? The rib cage should be very smooth, no bulges, no protrusions, symmetric, and no retractions. You see that? Retractions is a bad sign. Retractions is a bad sign. Okay, that's a complication. Irregular rhythms are common. Irregular rhythms are common. 18, more abdominal movement is seen during respirations. Inspiration is longer and louder than expiration. And vesicular or soft swishing sounds are heard over most of the lungs. So the lung fills, they're going to have these soft sounds. Now, for adults, you know that it's very different. So let me just go over it real quick with you, because this is a heavy hitter on the board. Remember, we specialize in airway, breathing, and circulation. So the lung sounds, I'm going to give it to you. I'll give it to you later, but the lung sounds, you remember for an adult, it's the first location is vesicular, and then you have bronchovesicular. All right, so let me just draw it. Hold on a second. I got to get it to you. All right, so for adults, this vesicular sound is a very soft sound, right? This vesicular sound is a very soft sound. So our lung sounds go as this. We do vesicular, we do bronchovesicular, we do bronchial, and then we do tracheal. These are all the sounds that we hear in the lungs. We hear vesicular, which is a very soft sound, bronchovesicular, then we have bronchial, and then we have tracheal. So with the infant, it's vesicular. It's very soft sounds throughout. There are going to be soft sounds heard throughout the lung fields. All right. So remember that. 121, breasts can be enlarged during the first few days. Of course, the breast can be enlarged during the first few days. That's expected. Sometimes they call it witch's milk. Children and adolescents' nipples and areolas are darker, pigmented, and symmetric. For females, breasts typically develop between 10 to 14. So 10 to 14, all right? The breast should appear asymmetric. They're going to appear asymmetric, right? But they should not have any masses and they should be palpable. It's going to appear asymmetrical. Our breasts are asymmetrical. Males can develop gynecomastia. That means breast enlargement. It may be unilateral. It may be bilateral. That occurs during puberty. That's natural. All right. 126, circulatory, heavy hitter. Heavy hitter. The circulatory system is a heavy hitter. We specialize in airway, breathing, and circulation. So 126 is a comprehensive assessment of the circulatory system, includes the pulses, capillary refill time. 128 is the neck. The neck is a part of the circulatory system. Those carotid arteries of the neck. Veins, clubbing of the fingers, and peripheral cyanosis. Peripheral cyanosis. That means the fingers and toes are cyanotic. Edema, you have to know the blood pressure and the respiratory status. So again, 126, pulses, 127, capillary refill time, 128, neck veins, 128 is neck, 129, veins, 130, clubbing of the fingers, 131 is peripheral cyanosis, 132 is edema, 133 is blood pressure, and 134 is respiratory status. So let's talk about the heart sounds. Auscultation should be done in both a sitting and reclining. So sitting and reclining in order to hear the heart sound. S1 and S2 heart sounds should be clear and crisp. So you should hear that lub dub, clear and crisp. S1 is louder at the apex of the heart. The apex of the heart, they call it the apical pulse. The apical pulse is you'll hear it. You'll hear S1 the loudest. And S2 is louder near the base of the heart. So remember your apical pulse. That's the apex of the heart, the apical pulse. And then 139 is physiological splitting of S2 and S3 heart sounds are expected findings in some children. Expected physiological splitting of S1, S2 is expected, and sinus arrhythmias that are associated with respirations are common. So sinus arrhythmias that are associated with respirations are common. That means that when a child takes in, like when they take a deep breath in, arrhythmias are common. They'll have an arrhythmia. Pulses. Infants, they have brachial pulses, temporal, femoral pulses should be palpable and they should be full and localized. You should be able to feel a brachial, a temporal, a femoral pulse in an infant. And as far as children and adolescents, pulse locations are expected findings are the same as in an adult. You'll find the brachial, you'll find the temporal, you'll find the femoral. Now I want you to write NCLEX because they want you to know if there's an emergency or if there's a CPR, what pulse am I going to palpate? It's the femoral pulse when there's an emergency. When you're doing CPR, you're going to palpate the femoral pulse. Abdomen now. Abdomen, it should be without tenderness and no guarding. Peristaltic waves can be visible. Those waves are going to be visible in thinner children. And shape, it should be symmetric and without protrusions around the umbilicus because that's an indication of a hernia. All right, so it's symmetric and without protrusions. Infants and toddlers, they have rounded abdomens. That's expected. Children and adolescents should have flat abdomens. And bowel sounds should be heard every 5 to 30 seconds. 5 to 30 seconds. Genitalia, anus surrounding the skin should be intact with sphincter tightening noted if the anus is touched. Routine rectal exams are not done with the pediatric population, despite what everyone thinks. Routine rectal exams are not done with the pediatric population. Hair distribution is diamond shaped after puberty in adolescent males, and no pubic hair is noted in infants and small children, so no pubic hair. 151, again, guys, hair distribution is diamond shaped, but I doubt you're going to get that. They're not going to ask you about that. But there should not be any hair noted in infants and small children. All right, I doubt you're going to get these questions, but I'm just going to go over them. Penis should appear straight. Urethral meatus should be at the tip of the penis because of sometimes you have the meatus is not at the tip of the penis, and that can be an issue. That's a complication. 155, foreskin might not be retractable in infants and small children. So the foreskin might not be retractable. And enlargement of the penis will occur during adolescence. And the penis can look disproportionately small in males who are obese, okay, because of the skin folds covering the base. Now the scrotum is huge, so this is something that you have to know, because sometimes the scrotum, you'll notice that the testicles don't descend, which can be a problem. So the scrotum hangs separately from the penis, and the skin on the scrotum has a rugose appearance and is loose, so it's like a saggy appearance. And 160 is a big one. The left testicle hangs slightly lower than the right. And the inguinal canal, it should not be absent. It should be absent of swelling. So the inguinal canal, it should not be swollen. The scrotum should not be swollen. And during puberty, the testes and the scrotum enlarge with darker scrotal skin. So that's normal during, during puberty. 163 for females, hair distribution is going to be documented. You'll start to see the hair, but it should be, that's normal. And again, hair should appear in an inverted triangle. No pubic hair for infants and small children. Now, as far as the labia, it should be symmetric without lesions. So that's huge because we do a lot of Foleys. Okay, you have to know how the female anatomy looks because we do a lot of Foley. So the labia should be symmetric without lesions. And the clitoris, small without bruising or edema. It should not be bruised. The clitoris, small without bruising or edema. And the urethral meatus is a slit-like appearance with no discharge. So that's an indication of infection. So these are the normals for our female. Musculoskeletal wise, length, position, and size of extremities are symmetric, stable and symmetric with full range of motion, no crepitus, no redness, so no cracking. You know, when you bend over and now we're hearing that cracking, the joints, that's not normal. So no crepitus, no redness. And the spine, which is huge. Infants' spine should be without dimples. If they have dimples, that's an indication, that's a complication. 173, they should be midline. The spine should be midline, right? The spine should be midline. And toddlers appear squat and short legs, and they have these round abdomens, protuberant abdomens. So that's normal. All right. Protuberant abdomens. Preschoolers appear more erect than a toddler. So a preschooler is going to be more erect than a toddler. A toddler is younger. And the big thing, 176 is huge. Children should develop the cervical, thoracic, and lumbar curvature like adults. Adolescents should remain midline and no scoliosis noted. And that's the issue here, the scoliosis. So adolescents should remain midline. It shouldn't be like this. You know, scoliosis, that's what we're screening for. And that is an NCLEX question, scoliosis. Gait, toddlers and young children, a bow-legged or knock-kneed appearance is common. It's a common finding. People say they outgrow it. So bow leg, knock-kneed, don't call the doctor. It's a common finding. And feet, they should face forward while walking. They should face forward, not like this. They should face forward. And older children and adolescents, a steady gait should be noted, even wear on the soles of the shoes. So a steady gait. So you're looking at the shoes because if the soles of the shoes are more destroyed on the sides, they may be leaning to the sides. It should be forward. Some people's feet are like this. We want them to go straight, and you can look at the sole of the shoes to determine even how if they're having any type of complications. And then our neurological, and we're done. Guys, you have to know your infant reflexes, okay? So the first one is sucking and rooting. Sucking and rooting reflex. How do you get the sucking and rooting reflex? It is elicited by stroking the infant's cheek or the edge of the infant's mouth. The infant turns their head toward the side that is touched and starts to suck. It's called sucking and rooting. You know, when the baby is hungry, you can swipe the cheek and the infant will turn toward the swipe of the cheek. Is a reflex, is how the baby survives. So it's from birth to 4 months. And then you have the palmar grasp. Palmar grasp is an infant reflex elicited by placing an object in the infant's palm. The infant will grasp the objects from birth to 4 months. They're gonna grab it. So if you put your finger there, they're gonna grab it. Plantar grabs, elicited by touching the sole of the infant's foot and the infant's toes curl downward. So if you touch an infant's foot from birth to 8th month, that foot is gonna grab your finger. Plantar. Think of plantar, like think of your foot, plantar grasp. And then you have the Moro reflex. This is elicited by allowing the head and the trunk of an infant in a semi-sitting position to fall. Backwards to an angle of at least 30 degrees. The infant's arms and legs symmetrically extend, then abduct while fingers spread to form a C. They, you know, the Moro reflex. Look at it, just make sure that you look at a video on that, guys. Moro reflex. And then you have the fencer position, or they may say the tonic neck reflex is the same thing. It's a tonic neck or a fencer. Just think of someone fencing. So elicited by turning an infant's head to one side. The infant extends the arm and leg on that side and flexes the arm and leg on the opposite side. This is from birth to 3 to 4 months. It's the fencer. Just think of when someone fences, that position. So if you turn the infant's head to one side, the infant will extend the arm and leg on that same side and flexes the arm and legs on the opposite side. That's how you know the neurological system is intact. And then our famous, put it in red, Babinski reflex. Put this in red. Elicited by stroking the outer edge of the sole of the infant's foot upward toward the toes, and the infant toes fan upward and out, upward and out. So if you stroke the edge of the sole of an infant's foot up toward the toes fan upward and out. This is from birth to 1 year. After 1 year, if someone has a head injury and the toes fan upward and out, that equals a neurological injury. U and O equals N-I. Upward and out for anyone over the age of 1 and that has a head injury, that is a neurological injury. It's supposed to go away after the first year. So the Babinski reflex is something that they use in trauma or in the ED to determine if a patient has a neurological injury after a head injury. So upward and out after the age of 1 equals a neurological injury. Stepping, elicited by holding an infant upright with his feet touching a flat surface. The infant makes stepping movements, birth to 4 weeks. All right, guys, that is it. That is it. All right, the lectures will be on YouTube. I'll put the timestamp, so if you can't listen to the entire lecture, you'll know where to go. We're gonna do the second part tomorrow. And that's it. If you need like extra little, let me show you guys. Make sure that you're doing your questions, number 1. But if you need extra little like guides, no answer, I don't have any answer keys, I'll send them to you guys. Hold on, let me show you. I'll send these to you guys. All right, so these will help. I categorize each worksheet. Like I put them in different categories. These are things that I used when I was in nursing school, and they really do help. These are like, if you go to health promotion and maintenance, there's some little worksheets for health promotion and maintenance to help you with sleep and rest, infant reflexes, pediatric language development. You have the cranial nerves there. So if you want to go there, and I'll send them to you also, age appropriate activities. So it does help with health promotion and maintenance. That's like a very difficult subject for me because it's just memorization. So I do a lot of worksheets. All right. And guys, I will. And I'll see you guys tomorrow. Okay. If I go on later tonight, I will see you guys at invite. All right. And I'll see you guys tomorrow, and we'll finish up health promotion and maintenance. All right, guys. See you later.